My name is Dr. Brandon Lawrence, co-inventor of the self-contained negative pressure environment, or more commonly known as the SCONE. This device was created as an adjunct to PPE in reducing the risk of infectious disease exposures to physicians and other healthcare workers in hospital emergency department settings. The SCONE was developed with clinical support from the Mayo Clinic to provide an extra layer of protection at the time of definitive airway management, when performing aerosolized generating procedures such as using a BiPAP or nebulized treatments, or during certain transport of patients in and through facilities. There are two ways that transmission can occur from an infected patient: droplets and aerosols. The mechanical barrier of the SCONE provides protection for healthcare workers when they come in close contact with the patient during procedures and treatments that generate these larger droplet particles. In this case, the SCONE acts as a barrier protection device. The introduction of negative pressure into the environment protects against the aerosolization of these particles before they have a chance to spread. The SCONE essentially acts like a vacuum and actively removes infectious aerosols from the environment surrounding the patient. And this is important because as of August, the FDA removed its blanket EUA that allowed use of the passive barrier protection, or more commonly known as the intubation box. And they encouraged more active barrier protection, such as the negative pressure SCONE. The great thing that you'll notice immediately is that it's quick, easy use and zero assembly required anytime a PUI rolls into your hospital. There is one oxygen port, there are two suction ports, but if your facility is only set up for one suction, that's okay. There are three pivot points on this device, which gives it this cabana-like shape, allowing for a perfect viewing window for intubation. There are four armholes, allowing access to care. And our data shows us that in under 5 minutes, we get total clearance of viral particles. As for suction, it's okay to use one port if your facility only allows that. But our data shows that if you use two ports at 30 to 70 liters of airflow per minute, it clears the viral particles in under 5 minutes. During important procedures such as an intubation, the RT can access through the side and the dock can hold the mask in place. Then during the intubation, using either direct laryngoscopy or a one-scope through this hole, or you can do your video laryngoscopy with cord through the bottom of the device. Once completed with the procedure, reseal your holes to allow for negative pressure. The device also has anchors so that if you're doing nebulized treatments or using BiPAP, you can make this bed go upright for patient comfort. One of the best features of the SCONE is that it's single patient use and fully disposable, so that sterilization techniques are not necessary. So other potential uses is for family visits and end-of-life care. Now as a physician, I would put the patient in this device immediately, allowing for their transport to another room to maintain sterility. And at that point, it's conceivable to have family visits safely.